we invite the assistants to take a seat, please. We will begin with the next session. So, well, let's begin. The next presentation is going to be given by Maria Carolina Quintana Noriega. The name of the presentation is Implementation of Spatial Correlations and Kernel Densities to Identify Deficiencies in the Coverage of Public Health Infrastructure. So please, Maria, go ahead.
Hi, thank you. I was asked to give this presentation in English. We don't have a lot of attendance right now, so I hope everyone is here to able to understand me. Also, I usually speak very fast. I will try to speak slowly. I do this also in Spanish, so it's not a language issue, but I tend to speak very fast. And as I get excited about what I'm presenting, I start speaking faster. So I will try my best not to go that fast. And I also want to take like 30 seconds of your time to thank the organization, the GIS LATAM group, for accepting this paper, and also for this great organization. We have felt very welcome here. And as you can see from the title, it looks like very complex and very technical. So what I try to do with the presentation is to try to keep it a little bit more simple, or simpler, I think. I hope I managed. So if there are any questions of any technical issues, we can discuss them after with no problem. I usually like to start by saying what are the background of the research that I'm presenting. And the thing with this topic that I'm gonna show you today is that it is actually the background for my PhD dissertation, for my PhD thesis. It was the first like the first steps, like baby steps that channelized to that bigger research. What this presentation, or what this research that I'm going to show you turned into part of a larger research that ended up in a linear model, in a linear regression model, and we used. I actually used this methodology with some other variables to elaborate and to discover these patterns of correlation. So it got a little bit more complex than I'm going to show you now. No? Just some framework, some reference framework about the data that I used. Mexico City as a state, not as the whole metropolitan area that sometimes we call that Mexico City too. It's not divided, but it's sometimes analyzed by the state, by the government. It's divided in these three containment perimeters, urban containment perimeters. 1, 2, 3, and the first one is usually the inner city that it has, or it's supposed to have the best infrastructure, and it should have all the needs met. And so we have a second perimeter, and the third perimeter that is all the peripheries of the city. And the concept of these perimeters, they help the state to know how the city is growing. But it's actually, I don't know if you can read into a little deep into that. It's a way for the state to acknowledge that they have not completely satisfied the urban needs in some other areas. No, so it depends on where you read this, no, or from where you are reading this. No, so the thing with this is that if you try to look into where the hospitals, and for my thesis I use also schools, where they are located, you can see that there's a correlation. There are more schools and more hospitals in the inner city and less in the outer city, no? Which would be this contrast here, no? So the hypothesis comes from this part. we looked, or I started looking at, and well, you know, the other doctors that helped with my research. We started looking at the data. We started looking at poverty measures, and we took all the infrastructure, all the health infrastructure that was located in these two outer perimeters, in these two outer perimeters. No? And we realized that there was actually or we could see a special correlation, a visual spatial correlation, no? At this point, between the highest levels of poverty and the actual location of equipment, of this less equipment. No? We already know from the urban perimeters, and this actually came into sense if we think about you know, this Lefebvre, the right to the city, and that people should be able to access all the infrastructure and all the services, no? And this obviously has an impact on the Sustainable Development Goals. So the topic about COVID might sound a little out of date because we are all above or over COVID, or we might think we are, and we are now talking about mpox and artificial intelligence, and those are like the main topics right now. But COVID left us a lot of knowledge, and this is where the importance of this research comes. This research, as I told you, was made before COVID. So I started my dissertation before COVID, and then COVID hit. So I got very early into the data. This data comes from maybe June 2020. June, July, somewhere around that. So that was a good point to take the data from, because after that everyone was getting COVID, and it was hard to see where the patterns were most intense. So in this point of the pandemic was very easy to see, and we started to see that we had a lot of we had a lot of cases in the peripheries, in the southern peripheries of the city, and we looked at spatial correlation, and we saw that indeed we had a very important spatial correlation, because COVID was getting contracted from people to people, so that was also from house to house, from neighborhood to neighborhood, and so on and so on. No? So we saw that there was a spatial correlation, and the other data that we used was the capacity of hospitals, which we can see here. Now, red are the capacity, was a critical capacity. And we looked into where the cases were coming from. So this is part of Mexican social security model. We tend to have hospitals near where people the people that have social security services are living. So we had a lot of cases here, but they were actually getting attended where hospitals were, no? And the thing is, if you remember this last one, we have these cases here, and the thing with that one is that we had no attention or no way to attend those cases, and here's where kernel density comes into place, because kernel densities are a very visual and helpful way to analyze point data, no? So if you look into a cloud of points, it's easier to see the patterns if you turn them into kernel densities, no? So what we did was take all the cases, put them into a cloud of points, and then develop the kernel density for those points, and we compare those with the spatial correlation. This is almost the results now. We compared those patterns of the kernel densities with the spatial correlation, and where the people were getting attended, and where the most cases were. And we saw that, okay, so the central area, where downtown Mexico City is, they had a lot of cases, but they were kind of well attended. And we saw some other hotspots which was very easy to identify with the kernel density and with the heat maps. And those patterns didn't show any problems. The problem came actually, if you think about this, I think that was on the last slide. Let me quickly go there. No, I don't think I have that one. Well, just I was here explaining just the survivorship bias. I thought I had another map with that. But if you think about survivorship bias, that's where the actual problem is for Mexican authorities and for the planning of health infrastructure, because we have a lot of people living in these peripheral areas that were getting COVID, and they had really no way to access public health systems, and that's what we could look at with these like easy methods, and we started looking also to this coverage. And well, yeah, that's pretty much it. I know I still have 5 minutes, but I try to make it shorter. As I was telling you, okay, so I had a lot of coding after that one, but after this one, just to tell you, we developed a linear model, linear regression model, using all this data, using also if the accessibility range of the health infrastructure, and we could focus on some very interesting parts of the city that turned out to be, let me go back to that one. It turned out to be these parts here, no? Which are like in the outside of Mexico City. They are no longer Mexico City. They are a state of Mexico, and that's where the main research ended. But yeah, that's kind of a huge other part. I actually did my dissertation here my PhD studies here in Polytechnico, so that one's accessible here at the I don't know, the repository of theses, and yeah, that's pretty much it. Let me go back to the last one, and yeah, thank you very much.
Thank you so much, Doctora Maria. Yes. We will pass with the question section. So if you have a question, you may raise your hand.
Maria, hi, thank you for your presentation. I was looking at your map maybe in slide 5, and you mentioned that the contagious pattern was house by house, neighbor by neighborhood. So
this one.
The following. Why do you think it's the low concentration near to the high concentration in this map? Why this spatial behavior appears?
In this part here?
Yes, the low concentration next to the highest concentration. It's quite interesting.
Yes, it was actually, yeah. Some explanation is that there are not that many people living, in that area. That might be some of our more industrial areas. I think that kind of is. But also, I think most of the people that have access to the health security system are concentrating here, and this area. It may also have that's another variable that we used afterwards. That they might be of a higher social economical level. So in Mexico, usually higher social economical levels, they use a private system, and this data was only for public health systems. So I think it was a combination of all these three. Maybe the concentration of users of public against of private. Also, that is a kind of an industrial area, and yeah, and the concentration of hospitals. Yeah. But I don't know if that's it. No? Okay.
Is there any other question? We only have time for one. Oh, okay.
Oh, it's not the best question if you get.
Go ahead.
Carolina, I wanted to ask you, this morning speakers were talking about difficulty to get data. And you mentioned, I assume you are talking about IMSS,
Yes.
Instituto Mexicano del Seguro Social, Social Security, the hospital system. Could you just share quickly what was the experience to get in touch with them or manage to get the data and the students working with it? Just curious in Mexico if you need to go through a lot of paperwork and approvals or it's a simple process.
Okay, yeah. For some reason, COVID data was very available during the pandemic. It was very easy to access them because everybody wanted to see what was happening, no? But and the location and the capacity of hospitals is still very easy to access. No, so that data is kind of easy, public, and accessible. But then if you start, where the problem is that when you start to ask for where those people come from, like exactly like this part, no? The thing that they were asking, the question they were asking. IMSS usually doesn't want you to know where their patients come from, no? So we have tried a couple of things. Actually, with Alexandra, with our other researcher, we have tried Voronoi, polygons, and maybe some hexagon. So to more or less know with the population density and the capacity to try to cross-reference those ones. And we are doing one research right now for Monterrey, and we asked the IMSS to give us, and it has been like 2 or 3 months and we haven't received an answer. So yes, that's kind of the thing. No? Even you're in an university and you can ask that, like, come on, we are using this for research, not for anything else. Yeah, it's sometimes not that easy. Yeah. No, thank you.
Yes. Remember, every kind of question is always welcome. Don't worry if your question is not that hard, if you think that's not hard. Thank you so much, Dr. Maria. We would like to thank you with a little gift from GIS Latam. So, yes. Thank you so much. Yeah, so we will